Here's the top 7 questions I get as a knee arthritis expert. If you're meeting me for the first time, my name is Dr. David. I'm a manual physical therapist and I have a clinic here in El Paso, Texas, and I see people in person here. I have other therapists that see people in person as well. And I also help people online in preventing knee arthritis. We have this program called the Knee Arthritis Recovery Program. We do some group coaching, we do some one-on-one coaching. So we're talking to people all the time on preventing knee replacement surgery and helping them with their knee arthritis. So here are the top 7 questions I get. Number 1 is, do I have to continue to do what my physical therapist told me to do? I get this question especially from our group coaching, from our online coaching clients, because they're doing the stuff that we recommend here on our YouTube channel in our knee arthritis recovery program, and they're also going through physical therapy in person. And this is always a tough one to decide on. Like, I can't tell you, a black and white decision on whether or not you should or shouldn't continue, because it's complicated in that, are they helping you? If you feel like you're getting better, hands down, I think that somebody helping you in person and you're truly getting better, that's the absolute best situation. That's why we still have a clinic here and haven't just gone 100% online with helping people, because there's something to it. There's something about getting hands on people and hearing their individual story and giving them a very unique plan of care that is custom to their situation, that just moves them along very efficiently in progressing their knee problems so they can get better again, so they can get back to being active. So I think that's the best thing ever. But if you're being hurt, I guess if anything, this is kind of like the black and white thing. If you're hurting in your physical therapy treatment, then first thing is communicate with the therapist. Let them know that, hey, this exercise hurts, that treatment that you did hurts, because they maybe they intended it to hurt and they didn't communicate that with you. Some therapists have this strong belief that some things should hurt, that whole no pain, no gain thing, that's what they're believing in. I personally don't subscribe to that. I think that pain happens as a result of your body not agreeing with something. And it's your body letting you know, stop doing that thing because I'm going to become irritated. The only time that I tell people something is going to hurt is if you've just had surgery, which I'm usually not helping people with. I don't see people that are recovering from surgery. I'm seeing people that are looking to prevent surgery. But if you've just had surgery, then you've been surgically cut. A surgery is basically a strategic, precise injury done to you by the surgeon in hopes that you're going to heal with the situation better than before. So this means that you have to recover from injuries sustained during the surgery, planned injuries. And bending your knee after it's been replaced, after the ends of the bones, they literally cut off the end of this bone, the thigh bone, all this is removed, and then an artificial part is put on, and then they saw off the top of this bone right here, and they put on an artificial piece here, and then they'll usually replace your kneecap with an artificial one as well. Wherever the incisions were made, on the skin, all the tissue, all of that has to heal, and for you to be able to bend your knee right after surgery, it's going to be painful. So that's the only time I tell people, when you're in the process of recovering from surgery, it's going to hurt. But otherwise, it shouldn't hurt. What you should feel is tired because you're working out muscles. That's normal. And you have to make sure to distinguish, I feel tired from I'm hurting. And when it comes to helping knee problems, you should be feeling tired in the glutes. You should be feeling tired in the foot muscles, maybe some of the muscles in between from time to time, usually not the quads, usually not the hamstrings too. But it shouldn't hurt in the knee joint. If you're having pain in the knee joint, then to me, something that you're doing is not right, and you're calling on that imbalance the wrong way, and it's making your knee worse. So given that information, whether or not you should continue to do what your therapist is having you do, you've got to figure that out. That's my answer to that. That's like the number one question that I get when it comes to helping people online with their knee arthritis problems. Number 2 is, are squats okay? Now, I get this one from people that are trying to do squats, obviously. And my answer is always, number 1, can you fire your glutes during the squat? if you can't, if you just do a mini squat, if you just partially squat and hold it, as long as it doesn't hurt your knee, if you feel pain in your knee, something's wrong right off the bat. But if you can hold it and you don't feel pain yet, but you feel like your quads are starting to get tired, you feel tightness work going through your quads, then it is not good for you. You need to not be doing squats right now. But if you can figure out how to make the squats use your glutes more and not use your quads so much, if you can make it a primary glute exercise to squat, then squats can become good for you as long as it's not aggravating your knees. So it's a later exercise. In other words, if you're hurting right now, if you're aggravated right now, don't do squats. It's probably going to hurt you. Don't force your way through it. It's a bad exercise right now today, but here in a month or 2 or 3, it might be an excellent exercise. In fact, people that are in the later phases of our knee arthritis recovery program, you can learn about that in the description below, find the link around us. They're doing squats as a requirement, but they're doing it in a way that uses their glutes, and it feels good. And it stuns people around them. People that reach the later phases of our knee arthritis recovery program, they're showing their therapist, they're showing their doctor, they're showing us all the time, they're showing off to people online, they're sharing it on social media. Maybe you can find one on social media. They're doing weighted squats. And oftentimes they haven't been doing squats on a regular basis. The reason they're doing these squats is because it no longer hurts their knees. It's actually helpful for their knees now because they're using their glutes and they're strengthening their glutes through the squat. So squats to me are a neutral exercise. It can hurt you or it can help you. It just depends when you do it and how you do it. Question number 3 is, how important is foot strength? Massively important. Now, the way to think about this is what percent, if you had to put your problem into a pie chart, for some people, foot strength is not a big deal. They actually have very good foot strength, and so it's not super important for them to focus on. They're not going to get a whole lot of value out of spending a lot of time on strengthening their foot muscles. But if you have a flat arch, if your arch tends to collapse down, then that's a sign that you probably need to work on your foot muscles. If you have a really high arch and it's rigid, it's stiff, that's another sign you probably need to work on your foot muscles. But if you don't really have any foot pain, if you have a pretty normal looking arch, you never really had any issues, and you can curl your toes like extremely, like where you can make the knuckles of your foot pop out, then you probably don't need to worry about foot strengthening very much, and you need to focus likely more on glute strength, especially if your glutes don't activate very well. So it just depends on how weak your feet are. And also, if I've had some people that do a really good job strengthening their glutes and they get a lot better, but they're not 100%, then we'll start to look at the feet as something to focus on more, because that might be the missing last 10, 20% that they need to improve in order to get their ability to where they can walk as long as they want, they can be on their feet for an hour plus, 2 hours or more, to where they can run, they can even do some jogging. We have people do that for sure. It just depends on how big of an issue it is for you. But it is important for everyone to some degree, just for some less than others. Question number 4 is, what shoes should I be using? Now, it depends on your foot strength again. It depends on your foot structure. If you have a flatter foot, you definitely need something with some arch support. I'll show you my shoes here just to give you an idea. So I have I like these shoes, and I'm not sponsored by them. Or once Olukai gave me a pair of shoes a long time ago. It was just like a gift they gave me because I wear these shoes in like every video. I love these shoes for the reason that they have an awesome insole, and mine are obviously used. But this is the insole that comes with the shoe versus the really flimsy thin ones. Like this one has like a gel support in there. It's nice, and you can purchase a support like this apart from your shoes if there's a shoe that you really like and put it inside your shoe. But I tend to have flat arches. If I'm on my feet all day, I appreciate shoes that have a little bit of an arch just to assist my arch. But I do work on my toe strength all the time. But having a shoe like this, if I'm going to be on my feet for a long time, is super helpful. Now you can see on the sole of the shoe, it's flat. But some soles, especially the soles of sports shoes, like your active shoes, they'll have a built-in arch support here in the sole of the shoe, which is also beneficial. This is for if you have flatter arches. If you have higher arches, you have to figure out what works best for you. Sometimes a little bit of arch support's beneficial. You usually need some flexibility in your shoes. You need the more flexible shoes for those stiff feet. But you generally want a neutral shoe. And the way you look at neutral versus not neutral is if you look at it from the front view right here, and if you pinch the edges of the sole, they should be the same height. That means it's neutral. Sometimes you'll see shoes that are thicker on this side. That means it's not neutral. It's posted up so that it's rolling your foot this way. Sometimes it's thicker on this side. It's pushing your foot this way. It's not neutral anymore. Same thing on the back. If you grab the sole of the shoe right here and just eyeball it, I'd be looking at it this way. I'd be looking at that, but I'm just showing you for this purpose of filming the video. It's equal here. That means it's neutral. If it's thicker on this side, that means it's gonna tip your foot outwards this way, and that's no longer a neutral shoe. And same thing if it's thicker on this side, now it's gonna roll your foot inwards, you don't have a neutral shoe anymore. So I would always look for a neutral shoe to start and then see if you need to change it. I can tell you in the last, I don't think I've recommended anyone in the last at least 5 or 6 years, that's the last one I remember, to get a posted shoe or a shoe that's not neutral, one that controls for pronation is what is the technical term. In other words, this person tends to roll their foot inwards a lot, so I told them get a shoe that's thicker on the inside so it rolls their foot slightly outwards, because that's what their ankle and their knee needed. But I think most people are going to be fine if you're strengthening your toes and if you have a little bit of support in there, whether it's from the sole or from an insert inside your shoe. It doesn't really matter as long as you feel comfortable. That's the golden rule with this, by the way. Footwear should feel comfortable, because I see people that go buy very expensive insoles and they're told by the salesman at the shoe store or the insole store, I won't mention any names of stores, there's one locally here in town that a lot of people like to spend $1,000 or more on insoles, and they're telling the people it's supposed to hurt. Wear it for a day, it's gonna hurt, and then you'll get used to it. I strongly disagree. You should feel instantly better if you have the right shoe and the right insole. You shouldn't have to grit through pain, because work your foot muscles outside of it. The insoles aren't working your foot muscles. They're just positioning your foot. And if you have an insole that positions your foot into a painful position, it is not a productive thing over the long term. So get comfortable insoles, get comfortable shoes, and start with neutral and then work your way out from there. Number 5, the question I get is, should I focus on losing weight? And for this it's a bit of a range. So if you're anywhere from about 40 pounds to 100 pounds, it's kind of a big range. Overweight, if you're in that range, then it's a toss-up. If you're over 100 pounds overweight, so if you should weigh 150 pounds and but you actually weigh 250 pounds, you're definitely in that over part of the range. You need to be losing weight. You need to focus first. Your priority should be to drop your weight down, because it's going to help, besides your knee pain, it's going to help a lot of other factors that you probably suffer from, a lot of other health problems. But if you're like 40, 50, 60 pounds overweight, then you're probably okay to start focusing on your knee problem first. Yeah, you need to lose some weight, and it needs to be done sometime soon. But if you're only 20 pounds overweight, even 30 pounds overweight, 35, 37 pounds overweight, I wouldn't focus on losing weight. I would focus on fixing your knee problem, getting better glute strength, getting better foot strength, all the stuff that I talk about. Because chances are you're gonna be able to boost your strength up faster than you can lose weight. Versus if you have a lot of weight to lose, it usually doesn't take that much effort to drop 10 pounds, 20, 30 pounds even, because you have a lot of weight to lose. But if you only have 20, 30, 40 pounds to lose, it's gonna take you a lot of effort to drop that weight, but it's gonna take you less effort actually to gain strength, which is gonna offset the pressures in your knee. Remember, knee arthritis, the root problem is a pressure problem. There's too much pressure going through the joint because of the muscle imbalance. If you don't weigh that much over if you're in that weight range that I'm talking about, if you're less than 40 pounds overweight, you don't have a lot of weight to lose, and the impact on your knee is gonna be tiny if you try to lose 10 pounds, if you're just a little bit overweight, versus if you flip that muscle imbalance, you're gonna feel a tremendous improvement. But if you're 100 pounds overweight, if you're 80, 90, 100 pounds overweight, then it's probably gonna be more of a priority for you to lose weight, because you are putting a lot more pressure through your joint at that point. But what gets under my skin is when I have patients come in, they obviously aren't 30, 40 pounds overweight, and they're focused on a comment that a doctor made that they need to lose weight. And maybe that doctor said it because they have a cholesterol problem or a triglyceride, like some other blood work problem that they need to lose weight for. Maybe they're connecting it to that, and that's a priority for them because they need to get off that medication that they're taking for that cholesterol problem or whatever it is. But when it comes to fixing their knee problem, the weight isn't going to help. And actually, it might be priority for you to fix the knee problem by fixing the imbalance so that you can tolerate walking more, so you can tolerate exercising in the gym, or maybe even some running, and then shed those last 30, 40 pounds that you need to lose to get off the medication. That's probably a better plan than waiting on fixing the muscle imbalance, waiting on doing the exercises needed to help your knee arthritis so you can lose the weight first. Not a good idea if you don't have that much weight to lose. Number 6 is, what is the best way to walk? I get this question so much, especially from our coaching groups. And I think people overthink this problem because there's a lot of moving parts, and you have to realize that it's more complex than you're making it out to seem, because you walk all the time and you think that you know how to walk, but once you start thinking about how to use your glutes, how to use your abdominals, and how to use your feet properly, and then if you throw shoes into the mix and insoles and all that, like there's a lot of things that people are considering. But my best advice to you is start with the glutes. Just get your glutes to work properly in the walking. When you bear weight on one leg, the glute on that leg should tighten up. And then when you bear weight on the other leg as you progress through the walking pattern, as you bear weight on the other leg, the other glute should tighten up. And then you're just alternating. When you step on your right foot, your right glute should tighten up a little bit. When you step on your left foot, the left glute should tighten up a little bit. And you're just repeating that. And very often when you're learning this for the first time, you need to just be in the hallway of your house or in the living room or in the bedroom, somewhere where you can put your hands on your backside and feel the muscles tighten up, and just practice walking on your own enough for you to get it, enough for you to crack it or to figure it out, so that then you can go out to the park, or you can go out to the mall, or you can, wherever you like to walk, get on the treadmill, and you can do it without having your hands back there all the time if that's what you need. Some people don't care and they'll do it anyway. It just depends on what you need to make this happen. But you need to make this happen. Start with the glutes. After you master the glutes, after you're like doing it 90% of the time with the glutes properly, then throw the feet in. Then start to add the abs. Then start to consider your shoes and your insoles and all that stuff. I wouldn't worry about all the extras. Start with the glutes and get that down right. If you can figure that part out, then the rest is cake after that. For the feet, just to give you the details on it, when you're just walking, your heel's gonna hit the ground first, and then as soon as your heel hits, glutes should already be starting to activate. Then once your foot's flat for that moment, as you're transitioning your weight onto the foot, the glute hits its maximum contraction, which I don't mean tighten your glute maximally. I mean, it's gonna fire like 20% of the maximum, but at the peak of its contraction is when your foot's flat. And then as you start to push off here, you're gonna already be landing your heel with the other foot, your other glute's gonna be working out. When your foot's flat, at that brief moment that your foot's flat, that's when your toes need to just slightly press down. Not curl, just flatten out, stretch out and flatten out. And then the whole time that you're walking, you need to be slightly braced with your abs. And when you brace with your abs, that reduces the side-to-side motion whenever you're walking, because some people don't realize how much they lumber, how much they tilt their body side to side. And whenever you do that, it changes the way your glutes work. It changes the way you load through your knees, through your thigh muscles, through your foot muscles. But if you can try to stay still, it doesn't have to be perfect either. There's still going to be some side-to-side motion, but it's reduced. Then you're going to be dispersing the forces throughout your joints, throughout your knees for sure, properly, the way that your body's designed to do it. And you're going to be optimizing your walking pattern. So just start with the glutes, add the other stuff later. I wouldn't think about feet until you're confident that you got the glutes down. Number 7 is, when should I start to exercise my quads? I love this question so much because I talk about the glutes so much. I talk about the foot muscles, and I poo-poo the quads all the time. And quads, they're not, there's a time to work out the quads. I don't think I've ever had a patient that has become imbalanced with the glutes, ever. I don't think it's ever happened. And if you're out there, please let us know. Get in touch with us. I want to meet you. I want to see what it took to get there. But in reality, if you're practicing walking, for instance, you're using your quads. You're going to be using your quads. You're going to be using your hamstrings. You're using all the muscles in your legs. All I'm trying to get you to do is prioritize using your glutes. If you can do that, then everything else falls in line. You're going to be using your quads to some degree. It happens once you get to weightlifting, once you get to squats, our knee arthritis recovery program towards the end, you're gonna be doing some weighted squats. And I mean like 5 pounds, even you start with 1 pound, you start with body weight and then you add 1 to 5 pounds. If you wanna proceed to 10 or more pounds, you can. I teach you the pathway on how to do that. You don't have to though, but you do need to do a little tiny bit of weightlifting because it's beneficial for you. But when you're doing those squats, you bet you're using your quads. But the priority is using your glutes. You have to feel like you finished the squats and your glutes got tired, but your quads will also get tired too. Your hamstrings will also work. Whenever you're doing any cardio exercise, you're gonna be using your quads and your hamstrings, but you need to prioritize the glutes and even the foot muscles. So there isn't really a time that I ever recommend people isolate their quads except for right after you've had a knee surgery, because consistently, if you've had anything done to the knee joint right after, I'm talking like the first week after surgery, sometimes it's even for a day or two after surgery, quads shut down. They just don't activate very well. And it's because you've been surgically operated. And so the quads freaked out and they said, what the heck happened? Now I've got incisions, the tendon's torn because I had to cut through it. The joint capsule's messed up. All the surgical stuff that had to be done caused the quads to not activate. So you need to spend a day or two thinking about, get the quads to work. But once the quads are activated, you're done. Now they're gonna work. Now you need to focus on fixing the imbalance, get the glutes to work and make the quads only work when they should, when they're supposed to, not dominating everything. So when to get back to quad exercises, my answer to that is virtually never. Just stick to making the glutes work primarily with all the other exercises you're doing, and by default, you're going to be using your quads. But you're not going to be prioritizing using the quads, which is important so that you don't over pressurize the knee and feed the knee arthritis problem.